facial nerve paralysis, or it is called as Bell's palsy. It is an acute weakness leading to the paralysis of the facial muscles. Mostly it is a unilateral one and is caused by the inflammation and compression of the seventh cranial nerve, that is the facial nerve. Facial nerve is a mixed nerve consisting of motor, sensory, and parasympathetic fibers. The main trunk divides into the multiple branches which supply the facial muscle, upper and lower facial muscles, and also it supply the salivary glands, tear glands, and the taste fibers, that is supplying to the anterior two-thirds of the area of the tongue. So it is a mixed nerve. There is a pair of facial nerve on both supplying the whole the face. That is the both side of the face, facial muscles and the glands. It is mostly a unilateral acute infection that leads to the paralysis of the upper and lower facial muscles, and it is a lower motor neuron lesions. The nerve, cranial nerve, seventh cranial nerve, called as facial nerve, that passes through a fallopian tunnel in the skull bone. When there is irritation, there is inflammation, and the fibers, connective fibers, and the other soft tissue surrounding the nerve, they put pressure due to the edema. So the electric current that passes from the brain to the periphery and from periphery towards the central nervous system, they are impeded. So the function of the facial nerve on one side is impeded or obstructed, and that leads to various dysfunctioning of the muscles of the face on one side. It is always one-sided, unilateral paralysis of the facial muscles. The etiology is traumatic injury to the skull bone. The injury due to the radiotherapy or surgical procedure done on the head and neck area. Mostly it is caused by the infection, that is viral infection. Herpes zoster, herpes simplex, HIV, mumps, rubella, influenza viruses. They produces the infection in the area around the facial nerve, and that produces the immune system to come into action and produces inflammatory cytokines, and due to this inflammation there is edema, and that edema put the pressure and the obstruction or blockage in the function of the facial nerve. The symptoms are, there is drooling, drooping, the patient is unable to close his eyes or her eyes completely, the smiling is incomplete, the patient is unable to elevate his eyebrows, cannot wrinkle the forehead muscles, which is a hallmark symptoms of this disease. So it is a key point that the muscles of the forehead cannot be wrinkled by the patient. There is dryness of the mouth and the cornea because there is reduced production of the glandular secretion due to the dysfunctioning of the various fibers of the facial nerve supplying these glands. So these are the various symptoms which are produced by the infection or the compression of the facial nerve. So there is dryness of the cornea and also there is pain in the facial muscles, mastoid area, in the ear and also in and around the ocular area, that is the muscles of the eyes. So there is numbness and tingling, that is called the paresthesia, due to the weakness in the functioning of the facial nerves in the face area. So these basic factors that leads to the sensitivity to the sound and the blurring of the visual, disturbance in the visual field, because there is also damage to the, that is the neuritis, and the retinal nerve is also is damaged in the progression of this disease, and that may lead to the chronic damage to the retina that may produces some degree of blindness and disturbance in the view. So these are the various symptoms which are produced by the Bell's palsy in the patient. There is also severe disturbance in hearing process because middle ear apparatus and the nerve, vestibular nerve, is also damaged by the viral attack. So the conduction of the sound through the electric current to the higher center of the hearing is also lost or weakened initially. It is an acute infection, can be cured easily by immediate preventive measures and the medical treatment, symptomatic and the antiviral treatment. But if it is ignored, the treatment is delayed, it may pass into the chronic stage. And that is difficult to restore the normal condition or the health of the patient.